In this 44th video, I take up an interesting topic. The topic is so much oxygen in this pandemic. You see, we witness a lot of problem with the shortage of oxygen for the COVID-19 infected patients in India or elsewhere. The reasons we'll try to sort out why there is so much demand for oxygen for COVID patient to save their lives. We'll see. We will try to analyze the problem and see. Try to elicit the reasons why there is so much demand for oxygen in this pandemic. So therefore, I made this video. The topic is so much oxygen in this pandemic. That is the topic. The SARS-CoV-2 virus COVID-19 infection causes pneumonia and hypoxaemia in the infected patients, which is the important fatal condition leading to the death of the COVID patients in these days. This is the pathetic situation. The new variant in India is highly infective and spreading fast and traveling in the air to a distance of 6 to 9 feet. A few antiviral drugs are effective against COVID infection, and treatment requires some time, say a few weeks. Due to pneumonia, saturated oxygen level in the blood of the infected persons will be very low, and to overcome this problem of hypoxemia, supply of oxygen into lungs is very important, and therefore it becomes an emergency treatment and a demand for the supply of oxygen. For this reason, the demand for the supply of oxygen in the hospitals to the patients, COVID patients, has increased multi-fold and creating a lot of problem. It's an emergency in India now for to supply oxygen to the COVID-19 infected patients. So it's an emergency. So the government of India, the state governments are really working round the clock to meet the increased demand of oxygen, to supply this oxygen for the patients to save their lives. So it's an emergency and emergency of oxygen in India. This kind of demand for medical oxygen was never experienced before, and the system for supply of oxygen in the hospitals, both private and government hospitals, was always restricted to intensive care units only. But now, today, the situation is different. The situation changed. Now, the intensive care units are working for saving the lives of the COVID-19 infected patients. So, COVID-19 patients, and in ICUs, the COVID-19 patients are admitted and oxygen being supplied continuously to save their lives, because they are their lungs are damaged, their lungs are subjected to COVID-19 infection. The virus is invading the lungs directly and damaging the lungs and resulting in the shortage of oxygen in the saturated oxygen levels in the blood of the patients is declining and decreasing. Therefore, when there is a fall in the saturated oxygen level in the blood, then problem of survival is very difficult. Therefore, the oxygen demand is increased multifold. This kind of demand for medical oxygen was never experienced before. So, since this high demand for medical oxygen is quite new in this COVID pandemic in our country and elsewhere, the industries are not able to meet the increased demand for medical oxygen in our country, in all the states. So in this present situation, to counter this problem of shortage for medical oxygen, it can be solved by establishing big oxygen generators in the big hospitals, both in the government and private sector, and to start industries for the manufacture and supply of oxygen concentrators, which can be conveniently used at home also. The establishment of big oxygen generators in big hospitals, both private and government, will solve the problem of shortage of oxygen for the patients in future. Patients of COVID-19 or any dreadful disease that will come in future. The production of oxygen concentrators will solve the oxygen shortage in respect of those who can afford to buy and use the concentrators, oxygen concentrators in their home. So those who can afford to buy the oxygen concentrators, they can purchase and use the oxygen concentrator in their home to save their lives. Such oxygen concentrators can be provided in small hospitals and rural areas in emergency. And a pandemic like this can be solved, can be, can, in this pandemic situation also, the lives of the people can be saved by the proper supply of oxygen, by using the oxygen concentrators and by establishing big oxygen manufacturing units in the hospitals, in the government hospitals, in the private hospitals. And with this we can solve the high demand for oxygen, medical oxygen, in this COVID-19 pandemic. Thank you, readers. If you like my video, you can kindly share, subscribe, and comment. Thank you very much, dear viewers.